That was Kirk Henkels from Stribling and Associates, an incredibly nice guy and very knowledgeable and amazing curriculum vitae and resume. I'm so impressed with him. And speaking of resumes, we have with us from Columbia University College of Physicians and Surgeons, Dr. Evelyn Granieri, who is the chief of the Division of Geriatric Medicine and Aging. Welcome, doctor.
Thank you very much, Rob.
So you and I spoke on the phone the other day, and I'm just going to give you a quick setup because what was really impactful what you said, which was we plan for things like weddings, honeymoons, pregnancies, but not for other things like getting old.
Correct. We don't. It's funny because I was just teaching that this morning to the interns, and it is true. We think about all sorts of contingencies, and we spend a lot of time in school for our career or our job, and all of the other sort of routine things that we do. We plan even to making a list to go to the store, but nobody really thinks about what the eventuality, which will happen to all of us. We will all get older. How much older is a question. But nobody thinks about how best to do that or what kinds of wishes you want as you get older. And I have to say that then also includes what you want during the last year or so of your life. And that's one of the things I really try and teach our young doctors and other clinicians, that they have to start thinking about how to do it for themselves so they can bring it up to the patients or the other people for whom they care.
Well, here's a question. The tough thing about being a doctor is, as you and I have discussed, and I don't bring this up much on the show, but I'm a type 2 diabetic, and I write about it a lot journalistically, and I also speak to a lot of audiences, more corporate audiences than anything else. And I never thought much about diet. You asked me a great question. We talk all the time on the show about the Mike Wallace questions, and you asked me on the phone the other day, if I could speak to myself now, like when I was 35 years old, about my diet and health, would I have listened? And I'm still trying to figure that out. And so as doctors, you have enough to do in terms of just treating people. It's how do you also help advise and teach your patients? Can it be done?
Oh, yes, I think it can be done. I think we have to raise the consciousness of everybody, starting from and this is in no hierarchical sort of framework, people who come in to see physicians and the physicians themselves. I mean, we really have to change the way in which we're viewing, yes, I believe, life and the progression of life. And that our vow, our oath as physicians really is to help people through this journey we call life. And that journey doesn't end, when you leave the office. In general, it doesn't end if you are dying. You need a physician, and I don't mean like you're going to die tomorrow or next week, because most people have a relatively prolonged phase during which they're sort of exiting this sort of terrestrial life. But we have to recognize as physicians and as healthcare clinicians what it is that people really want in life. It impacts every facet of the care that we provide. It impacts every facet of their relationship with their loved ones. And I think that to deny that we need to do this just as much as we need to make sure that your glucose is under control or your blood pressure is under control, we have to be forward thinking in terms of, okay, what are you thinking about? What do you enjoy? What are your goals during this earthly existence? How can I help you with that? And how can I help you when those goals can no longer be met? And it's really one of the basic tenets of geriatric medicine, because by definition, we're taking care of people who are in the last phases of their lives.
What qualifies somebody for the term geriatric? Is there an age, or is it a state of being and health?
That's an interesting question, because when I first was in training in the late 80s and early 90s, it was 65. And of course, as I approach that age, I'm thinking, 65? No way. But now we're thinking that probably closer to 75, that's when we start to see physiologic changes that the body, that most people's bodies encounter as people get older. So we're thinking now more toward the mid-70s, although that's not a hard and fast rule, since very younger people can have the complexity of diseases and psychosocial and issues that would qualify them as needing the care of a geriatrician. And there are a lot of older people who actually don't need a geriatrician because they're actually functioning fine, their cognition is intact, and they're maybe taking one medication. So,
well, another thing we discussed on the phone the other day is I use my family history because we have a history, sadly, of congestive heart failure. So my paternal grandfather died at 66, and this was in 1966 of a massive coronary because there wasn't such thing as a bypass then. And then my dad, I guess it was in the 80s, when he was 66, had a massive coronary, but they took him to the hospital and he had the 4-way bypass, and his life was prolonged for another 20 years. Right. So we're able to do that with the body, but we haven't seemed to come close to catching up with the mind, and so hence all these people are living longer and they're dealing with Alzheimer's, which seems to be an area that you cover.
It is. I mean, this may sound strange, but my passion really is taking care of frail old people, especially those who have dementia, because it is, despite what the recent report said, they thought that dementia was declining. I think that was an erroneous report, but and I just want to address Alzheimer's because the truth is that once you reach the age of 85 in this country, chances are 50-50 you're going to have some kind of dementia. And it may not be Alzheimer's. It may be a dementia that's caused from hypertension that's out of control, or blood glucoses that are out of control, or your atrial fibrillation that's been out of control. There are numerous causes. They're not all Alzheimer's, but they're all dementias. And they all lead to the same thing, which is, at the end, you live maybe 5-6 years. And that's when the planning has to start before that time.
Well, can I direct anybody to the website as we're wrapping up that they can look at for you?
Sure. It's on the Columbia University College of Physicians and Surgeons Geriatric Medicine, and they'll find it there. And they're welcome to look us up and talk.
I have to have you come back on the show again, and we'll talk again soon. Dr. Evelyn Granieri, thank you so much for joining us on Striblings, New York.
My pleasure. Thank you, Reb.